In the last episode of Let's Go Shorts, we discussed comorbid diseases that can accompany obesity. When seeing a patient who has obesity, it is important to complete a good history, including an obesity-specific review systems, a thorough physical exam, and consider which labs and studies might be needed to identify other conditions that can be present and may need to be treated along with the obesity itself. Often we need to address both conditions. For example, treating a patient with depression can help them with regard to being in a better place to focus on goal setting, diet and exercise changes, and self-care. Treating sleep apnea can help with fatigue, decrease inflammation in the system, help mood and motivation. I am Pete Ammon and work for MaineHealth as an obesity medicine clinician at the Weight and Wellness Program in South Portland, Maine, where we address both medical and surgical approaches to the chronic disease of obesity for both children and adults. Doing a thorough augmented obesity-specific review systems can be helpful to discover signs and symptoms of underlying disease. Snoring or sleep disturbance might be seen with obstructive sleep apnea, anxiety, or other mood disorders. Abdominal pain may be seen with heartburn, constipation, gallbladder disease, or fatty liver disease. Menstrual irregularities could be seen with PCOS or Prader-Willi syndrome. Orthopedic issues could underlie slipped capital femoral epiphysis or Blount's disease. Musculoskeletal issues like arthritis or plantar fasciitis. Polyuria or polydipsia can be seen with type 2 diabetes. Anxiety, school or work avoidance, or social isolation can be seen with depression. And severe recurrent headaches with idiopathic intracranial hypertension. A patient with shortness of breath may have asthma or heart failure. The augmented obesity-specific physical exam can fine-tune your patient's needs. We should check blood pressure using a correct size cuff every visit to look for hypertension. Short stature may underlie endocrine conditions such as hypothyroid. Acanthosis nigricans can be a sign of increased risk of insulin resistance. Acne and hirsutism could be seen in PCOS. Skin irritation and inflammation can be seen in intertrigo. Papilledema or cranial nerve 6 paralysis can be seen in IIH. Tonsillar hypertrophy may be seen with obstructive sleep apnea. A goiter may be a symptom of hypothyroidism. Patients may have wheezing, asthma or heart failure, and distended abdomen with GERD or gallbladder disease. Patients may have an abnormal gait or limited hip range of motion, which could underlie a slipped capital femoral epiphysis, and bowing of the tibia is seen in Blount's disease. Small hands and feet or polydactyly can underlie some genetic syndromes, which can increase risk for obesity. Consider screening tests for depression, anxiety, binge eating disorder, and attention deficit disorder. Sometimes these screens are more difficult to administer in primary care, and a referral for a social worker or other mental health professional would be necessary. Many patients that struggle with their weight are at risk for sleep apnea. A study from 2008 showed a strong relationship between obesity and sleep apnea, and that almost 60% of moderate to severe sleep apnea occurs in patients who have elevated BMIs. Untreated sleep apnea can increase risk for stroke, heart disease, high blood pressure, and diabetes and make it more difficult to lose weight. Treating sleep apnea can help weight loss, and losing weight is one of the best treatments for sleep apnea. Unrelated to sleep apnea, if you sleep less than 6 hours per night on average, you may also be prone to eating more and gaining weight. Think about lack of sleep or poor sleep as a risk factor for obesity. The STOP-BANG Screener is one of a few screeners for sleep apnea that takes a few minutes to administer and can be helpful to determine who should have additional testing and perhaps a consult with a sleep specialist. Sometimes a patient would have a negative sleep study in the past, but if they have gained additional weight since that time, you might want to consider rechecking. With regard to lab evaluation for pediatrics, the American Academy of Pediatrics just updated their clinical practice guidelines in 2023. For children aged 10 and older who have obesity, the recommendation is to screen for diabetes with either a fasting glucose, A1C, or glucose tolerance test, and to screen for a fatty liver disease with an ALT. For children aged 10 and older in the overweight or obesity category should also have a fasting lipid panel. For younger children with obesity, clinicians may check a fasting lipid panel. There is less risk at this younger age for diabetes or fatty liver disease. For adults, we often will check a fasting lipid panel and a fasting sugar or an A1C, which helps identify elevated lipids, prediabetes, or diabetes. Doing a comprehensive metabolic panel may show inflammation in the liver if AST or ALT are high, or kidney problems with a high creatinine. A TSH can show thyroid disease, and vitamin D is often low in patients who carry extra weight, since vitamin D is stored and sequestered in fat cells. An elevated uric acid can show increased risk for gout. Other studies that may be appropriate, including cardiac testing with an EKG, echocardiogram, or stress test, or sometimes a sleep study can be helpful to identify sleep apnea. You will likely need to schedule a follow-up visit with your patient to review screening studies, labs, and other tests to come up with a treatment plan for obesity with your patient. The Obesity Medicine Association has 4 pillars of treatment we should think about with each patient, including diet and nutrition, physical activity or exercise, behavior, and weight loss medications. Also, thinking about and discussing potential for weight loss surgery can be life-changing for the patient with regard to long-term improvement in their health and quality of life. These treatments will be discussed in future Let's Go Shorts.